Hi, and welcome to today's webinar on counseling considerations for people with autism spectrum disorders. Before we get started today, I want to make a couple of announcements. We know many of you don't live near our center, and that's why we provide this free webinar series. We host several webinars per month, so please visit our website to view the current schedule for 2018. Simply visit our website at www.johnson-center.org and click on the webinars link on the right-hand side. New webinars and events are often added, so if you are not on our email list, I encourage you to visit our website and click on the Join Our Email List link that appears on the homepage. To get instant news and events from the Johnson Center, follow us on Facebook, Instagram, and Twitter, as we often announce grant and scholarship opportunities, research opportunities, and special events and presentations there. And be sure to check out our YouTube channel at youtube.com/The Johnson Center, where you will find a library of several of our past webinars covering a wide variety of topics. For those of you who are local, be sure to follow our social media pages for upcoming announcements about exciting spring break and summer camps and classes, our April Teddy Bear Clinic, and a special announcement for new grants and scholarships for diagnostic and counseling services. And be sure to follow our colleagues at the Autism Research Institute as they host their own webinar initiative, and they share some great resources on their website and social media pages. If you would like a certificate of attendance after today's webinar, look for a follow-up email in your mailbox 1 hour after the webinar concludes, or look for the link on our YouTube channel in the webinar description. It will contain instructions on how to get your certificate. If you have questions during the live webinar, you may type them into your GoToWebinar control panel. If you are watching a recording of this webinar, you may email questions to the presenter at info@johnson-center.org. So let's get started. Today's webinar is presented by Amanda Tami. Amanda holds a master's degree in counseling psychology and has completed a recertification program in applied behavior analysis. In addition to being a board-certified behavior analyst, Amanda is also a licensed professional counselor. She has experience working with both children and adults, including those who have autism spectrum and other pervasive developmental disorders, ADD, ADHD, anxiety issues, and trauma, both as a BCBA and as a counselor. She has additional specialized training as a counselor in EMDR therapy and its applications to children. We're lucky to have Amanda share her experience and knowledge as the head of the Johnson Center's Behavioral Services and Counseling programs. Amanda comes from a unique position in her education and background to understand the challenges that clients and their families face, developmentally, behaviorally, emotionally, and systematically, to see the patterns and teach the skills needed to improve quality and functioning in all aspects of life. Please welcome Amanda.
Thank you, and thanks everyone for being here today. We're talking about a subject that I am very passionate about, and that is counseling considerations for individuals with ASD. It has been long thought that counseling was not an appropriate treatment for people with autism, but we're learning that that is not true. And today I'm going to talk about some modifications and some ways that counseling can benefit someone with autism spectrum and related disorders. So in this presentation, I'm going to cover the psychotherapy benefits for people with ASD, what types of psychotherapy can be effective for people with autism, what conditions psychotherapy might help, or what symptoms psychotherapy might help for people with autism, and some considerations if you're looking to find a therapist for yourself or someone you know with autism. Now, let me just clarify before I go any further that there are many terms for what we're talking about today. Counseling. Counseling is one of those terms. Psychotherapy, talk therapy, or just therapy are all words that refer to the same thing, to counseling. So as I use any or all of those words, know that I'm talking about the same thing. So let's talk about what psychotherapy is and its benefits for people with autism. So what is psychotherapy? Well, according to the American Psychiatric Association, psychotherapy or talk therapy is a way to help people with a broad variety of mental illnesses and emotional difficulties. Psychotherapy can help eliminate or control troubling symptoms so a person can function better and increase well-being and healing. There are lots of different types and approaches to counseling. And it might look different depending on the therapist's approach and their training. And there's no right type of therapy for any one person or any one condition. Each therapist brings their own experiences and training and has their own techniques and benefits for whoever it is that they're seeing. So first, as we talk about who might benefit and how psychotherapy can benefit people with autism, first realize that there are lots of reasons that someone might go to therapy and lots of possible outcomes. The ones that I have listed here are only a few, but they are some of the main purposes, the main reasons that someone would go to therapy. The therapeutic relationship, or the relationship between the therapist and the client, is believed by many who study counseling to be the single most important component in improving someone's symptoms. So finding the, can everybody hear me? So finding the right therapist for you is extra important, and having an effective therapeutic relationship can help to heal other relational wounds. So the therapeutic relationship just meaning the relationship between you and the therapist. And that's one of the most important components of therapy and can be healing in and of itself. Therapy is also a source for people to learn more coping skills, or as I call them, resources. These are positive experiences and coping tools that we can learn to help to decrease and tolerate intense negative emotions. Sometimes the emotions that we have are unavoidable. We're in a situation and we can't, or it's not healthy to escape the emotions, but therapy can help us learn to be able to tolerate those emotions more effectively without getting overwhelmed. Therapy is also a place for support and venting, validation, and the perspective that you can gain through therapy can go a long way toward improving maladaptive thoughts and emotions and behaviors. Some people come to therapy with a goal of behavior change, whether that's ending a bad habit or learning to stay away from unhealthy relationships. Therapy can help clients replace unhealthy behaviors with more adaptive ones or patterns of behavior. And finally, insight and reprocessing are some of the what most people think of therapy as for. And in insight and reprocessing, that type of therapy, a client makes connections between their past and the present. Sometimes insight alone can help a client change their patterns, but sometimes more reprocessing of that past event is needed to change symptoms in the present. So let's think about psychotherapy specifically for people with autism. Who might benefit? Well, first of all, psychotherapy is not a cure for autism. It is not going to change functioning in ways that the person will no longer meet criteria for an autism diagnosis. However, it can be effective in reducing symptoms of co-occurring or secondary disorders, meaning those things that go along with autism but are not necessarily a direct symptom of autism. We'll talk more about some of these co-occurring disorders in just a few minutes. So the benefits and purpose of counseling for someone with autism will vary depending on their cognitive abilities and their level of insight. Many people with autism can benefit in some way from psychotherapy, but the purpose and the outcome might look different for someone with higher level cognitive abilities than those with lower cognitive abilities. So people with autism who are considered to have milder symptoms of autism and therefore higher cognitive abilities may have higher levels of insight, and this can allow them to do insight-oriented therapy, reprocessing of past events to decrease the intensity of emotional experiences, change thought patterns, change behavior, all of those more complex therapeutic processes. Someone who's more severely affected by autism or anyone with lower levels of insight can still learn to use resources and coping strategies to calm their nervous systems. So if you have someone who's considered low functioning, I don't like that term, but since that's the term that is most widely used, I'm talking about people who have more severe symptoms of autism. But if that person has high anxiety, they may still be able to learn some of these strategies to reduce anxiety, even if they don't have the ability to gain insight or look at how their past affects the present. They can still learn those coping strategies or the resources. Someone who is nonverbal can still establish a therapeutic relationship and learn those skills given the right therapist if they have some way of communicating. Okay, so as I said at the beginning of this presentation, there are many different approaches to therapy, and certain types of therapy have research that show their effectiveness with people with autism. And I'm going to go over some of those now. That is not to say that other types of therapy are not effective with people with autism. These are just the ones that have some evidence. The first is cognitive behavioral therapy. This type of therapy is the most common that's used for people with autism, and it's really most appropriate for those who are highly verbal. In cognitive behavioral therapy, the therapist helps the client form connections between emotions and thoughts. We improve emotion regulation by changing maladaptive attitudes and thoughts to reduce negative emotions. We do this using strategies like problem solving, exposure, in which you think about or in some way confront some anxiety-inducing stimulus rather than avoiding it, and cognitive restructuring, also known as thinking traps, in which we identify maladaptive thoughts in order to modify the cycle to have a better outcome. The cycle being what's shown here, that thoughts, emotions, and behaviors all affect one another, that negative thoughts lead to negative emotions, which lead to maladaptive behavior, which lead to more negative thoughts. Lots of research shows that CBT is effective in treating anxiety in autism. There is less research showing its effectiveness in treating other disorders like depression or basic emotion regulation issues or more complex issues. They are not as well studied, but CBT does have evidence showing that it's effective in treating anxiety in people with autism. Many therapists are familiar with CBT or the techniques of CBT. Modifications can be helpful, and we're going to talk about some of those modifications in just a little bit. But therapists with expertise in autism are not always available. So CBT can be a good option for someone looking for for a therapist for someone with autism. One of the disadvantages of CBT is that CBT strategies are very cognitive, meaning they require a lot of thought. And so it can be hard to use these strategies in real life once we're already distressed. And this happens very rapidly for people with autism. They go from a place of feeling okay to high levels of distress pretty quickly, which we're going to talk a little bit more about a little bit later. But that is one of the disadvantages of CBT. Acceptance and commitment therapy is also commonly used for people with autism and has some evidence showing that it is effective. Acceptance and commitment therapy was developed by psychologists and behavior analysts who believed that challenging behaviors could be in response to internal events like thoughts or emotions. In acceptance and commitment therapy, A, C, and T are its core components. A is acceptance, accepting by mindfully allowing yourself to experience emotions or present experiences while separating yourself from your thoughts. So, for example, you might mindfully feel unpleasant feelings instead of trying to avoid them or avoiding situations that evoke them. In addition, you're creating distance between yourself and the thoughts that you have about yourself. For example, if one of the thoughts that frequently comes up for you that causes distress is, I'm bad, you learn to separate yourself from that thought by thinking instead, I'm having the thought that I'm bad. You acknowledge that the thought I'm bad is there, but you also remind yourself that it's just a thought, and thoughts don't always have to be true. C is commit. You commit to the values that you determine to be important to you. So when something feels bad, something is not in line with our values, with what we find important in life. So we need to do T. T is taking action in accordance with your goals or values. So you do something to realign your behavior with your values, whether that's changing your behavior so that you're no longer doing this behavior that feels bad or leads you to feel bad later, or doing something to repair something that you've already done. And the third type of therapy that I want to talk about that has shown to be effective with people with ASD is mindfulness. There's lots of research going on about mindfulness right now, much of it with ASD, but for lots of other things too. Mindfulness is gaining a lot of popularity in the counseling field. Some therapists are mindfulness therapists, while a lot of others just incorporate mindfulness as an intervention or teach mindfulness strategies to help as a resource, as a coping skill. Mindfulness is actually a key component in ACT, acceptance and commitment therapy, which I just talked about, but it can also be used as in many other types of therapies or even as a therapy alone. Mindfulness is the act of attending to emotions and thoughts in the present without judgment. Whatever is your present experience, that's where your awareness is. You're not trying to change it. You're just allowing it to happen and noticing what it's like without judging or trying to change. This increased experience of emotions can help to increase awareness of emotions. It is common for people with autism to have a decreased awareness of emotions, especially at less intense levels. Once emotions get really high, we might be able to identify them, but once they're really high, it's also harder to regulate those emotions. Mindfulness also allows us to slow down before taking an action, which makes us less likely to act on impulse. And acting on impulse happens a lot when emotions are really high. And mindfulness decreases our tendency to suppress or escape that unpleasant feeling or situation, and instead just experience it so that we can move through it. I'm about to talk about some specific conditions or diagnoses that someone might have alongside autism that psychotherapy could be helpful for. And we'll see that the tendency to suppress or escape unpleasant emotions is core in a lot of those. So here are just some modifications that a therapist might make in therapy to make therapy more effective for someone with autism. One example is making things concrete. So whether that's using pictures or drawing pictures or writing things out, personifying things. You might personify anxiety, make it a real physical thing. Anything you can do to make these ideas, these abstract concepts, more concrete, more physical, can be really helpful. So, for example, if you're doing a mindfulness strategy in which you're teaching someone to notice their breath, maybe instead of just telling them, notice your inhale and exhale, you might have them color their breath or draw their breath somehow and color as they go. Maybe you would do mindful eating exercises in which they notice the different characteristics of some food that they're putting in their mouth. This makes it concrete and physical, and that they can actually relate to it in a physical way, rather than just the abstract concept of, well, notice your thought and don't try to change it. That can feel really hard for someone who has trouble with abstract thought. You might do shorter sessions or do shorter periods of work during your sessions and plan for breaks in between. So maybe you schedule 10 minutes of whatever type of therapy interventions you're doing, and then you take a 5-minute break to do some preferred activity or have fun. Someone with autism might need more resourcing than other people do, meaning they may need to spend more time learning coping skills or learning how to regulate their emotions in a more effective way. And this is an important part of therapy for anyone, but it could be even more so for the person with autism. Emotional literacy means the ability to identify emotions that you're experiencing and recognizing them when they're happening. And we're going to talk a little bit later about something called Lexithymia, which is common in people with autism. And in Lexithymia, it's difficult to identify your own emotions. You still experience them, but you don't recognize the emotion as that emotion while you're experiencing it. So teaching the client how to do that might be a needed intervention that you would incorporate into therapy. Social skills, helping someone recognize the social intricacies or recognizing how their behavior affected what happened next, or how their behavior affects their thoughts or emotions. Routines and schedules can be great to incorporate. If you're, you might do work with the client to write up a schedule of what you're going to do during the session. Maybe you write up a schedule to plan for breaks and repetition and practice. The more we can provide opportunity to use the skills that we're teaching them and excuse me, and practice over and over, the more the skill becomes accessible. And here's what you need to consider when we're learning a new behavior, which if we're learning coping skills, we're learning a new behavior. It's really difficult to learn a new behavior when emotions are really high. So it's so important that when we're teaching coping skills, we teach them when the person is calm and is in a state where they are able to learn. If we try to teach them how to take deep breaths or how to use a mindfulness strategy when they're already really angry, they can't learn that skill at that moment. That part of their brain is not able to take in information. So we need to teach the skill when the person is calm and is in a place where they can learn it, and provide lots of opportunity to practice. And then when they're in the moment when they need it, remind them, prompt them to use that skill, and they already know how to do it. They might not remember to use it in the situation where they need it. They may need a reminder, but with enough practice with that, they can learn that, oh, when I'm angry, this is the strategy I need to do, and eventually be able to use that strategy before their anger gets too high. Part of learning emotional literacy is identifying lower levels of different emotions so that they can recognize them before they get out of control. Okay, so let's talk about what psychotherapy might help in a person with autism. I'm going to give just a very simplistic explanation of how the brain works to better explain some of the conditions. Essentially, the brain works differently when emotions are really high than when we're in a neutral state. The brain evolved from reptiles to mammals, and the evolving brain developed on top of the earlier brain. The reptile brain is down here, and the human brain is up here. The reptile's brain's focus was survival, protection, and getting needs met. It's a direct path to the amygdala, which is the part of the brain that's responsible for the fight or flight response. Fight or flight being our survival response, that if there's a threat, the body gets ready to fight it or run away from it, and that's how we survive for a long, long time. The human brain is capable of much more complex cognitive tasks like reasoning, logic, planning, time sequencing, all those things, the executive functions that the frontal lobe does. Some people refer to these as these two brains as the lizard brain and the wizard brain. When we're anxious or in any heightened emotional state, good or bad, the frontal lobes turn off and the reptile brain takes over. When this happens, we're in survival mode and we act based on our emotions, not on our thinking. Now, the reason for this is biological. The amygdala processes and reacts to a threatening stimulus in 12 milliseconds. The frontal lobes take 250 to 300 milliseconds. And for us as humans who normally think of time in terms of seconds as being the smallest unit of time that we generally use or think of, 12 milliseconds to 250 to 300 milliseconds, that all just seems really short and not that big of a difference. But when a true life threat is present, there is not time for the brain to send the information through the frontal lobes and make a rational decision. The amygdala makes that decision to go into fight or flight mode much faster and therefore increases the chance of survival. So anytime that we're facing a real or perceived threat, the amygdala takes over. In today's world, many of the threats that we face are perceived. They're psychological. There's no real threat to our physical lives, our survival, but the brain can't differentiate between psychological and physical threats. The brain responds the same way with the fight or flight response when we feel unsafe enough. Everyone experiences this sometimes. Public speaking, a big test, relationship conflict. Just a few examples of things that might make us feel anxious or uneasy. Well, the person with autism faces a whole set of additional stressors that many other people don't even notice. But this additional set of stressors is constantly bombarding them, and the amygdala is always at risk of being turned on or of responding. So here's just a few examples of those additional stressors. Things like the social nature of the school classroom. The classroom is inherently social. And for someone with autism who has social challenges, they might feel like they're constantly having to face this challenge. Sensory stimuli. Never underestimate the effect that sensory stimuli can be having on someone with autism or sensory processing disorder or any sensory sensitivities. Communication challenges and the social expectations. Public performance. Some people with autism report feeling like they're always acting. They always have to be on, and they always have to be putting in a lot of effort to read the cues or to figure out which version of themselves they're supposed to be. And these are things that come naturally to people who don't have those types of social challenges. Unexpected changes are unavoidable, but can be really difficult when we don't know what to expect, what's coming next, how to predict. Alexithymia, I mentioned that a little earlier, and we'll talk more about it later. Slower processing time, a chaotic environment, whatever demands are being put on the person, whatever we're asking them to do. Being perceived as different can be a really big trigger for some people. And a lot of people think that people with that this is only only a problem for people who have Asperger's or those milder autism symptoms. But it's been my experience that even people with more severe symptoms of autism can see that they're being perceived as different, and that can be a source of anxiety. Unpredictability and the delayed cognitive abilities, those executive functions. These are all stressors that someone with autism might face on top of the everyday stressors that everybody else might experience. So I like to use the analogy of a smartphone to describe what's happening in the brain. The smartphone has all these apps, and each app contains information for that app. When you open the app, you can access all that information. So if you open the Snapchat app, you can see all of the snaps, you can post your own, you can change your profile information. So think of the brain as your smartphone, and all your experiences and memories are your apps. There's an app for each one. When you open the app, you can get all the information that's stored for that memory, the thoughts, the feelings, the body senses, sensations, the context. Sometimes one of those apps is opened. Maybe it just gets bumped by accident, and out come all the feelings that go with it. All of a sudden, we're having a meltdown, or emotions get really overwhelming. It's all too, it all comes out really intensely, and we don't even know why. And sometimes apps are open and we don't even realize it. We might have a whole bunch of apps that are open in the background, but we're not using them. We don't even know that they're open. We're still doing what we need to do with the phone. We can use the programs we need. We don't even know that those apps are open in the background, but they're still affecting the phone. The phone's battery might not hold a charge. It might be running really slow. The same thing happens in the brain. Sometimes those apps are open in the brain in the background. We don't even realize they're there, but they're still having that effect. They might make us have trouble sleeping or have really low energy. We might be irritable or on edge. They're affecting the nervous system without us even realizing it. So all of these everyday stressors that the person with autism faces are running in the background, even if they're not having a huge reaction. The stress is still there, activating the nervous system and increasing their baseline level of anxiety. The more anxious the person is, the less able they are to cope with demands and stressors. The more stressed you are, the more your body and brain are doing fight or flight things, and the less you're able to problem solve, self-soothe, things like that. According to Tony Atwood, who is an expert in Asperger's research, baseline levels of anxiety are often higher than average for someone with autism. So let's say the typical person's baseline level of anxiety is around a 3. Well, the person with autism's baseline level of anxiety is around a 6. For that baseline level of 3, an anxiety-inducing stimulus like there's really bad traffic and you're going to be late for work. Well, that might put you up to a 6 or a 7. But for that person with autism, whose baseline is already that high, the same stimulus puts you all the way up to a 10 on the anxiety scale. So it's no wonder that someone with autism might have a really big reaction to a not so big problem. If they're living with that much anxiety in everyday situations, it doesn't take much to push them into a panic. Now, this higher than average baseline level of anxiety might be significant to warrant a diagnosis of generalized anxiety disorder. Even if it doesn't reach that level, therapy can be helpful in decreasing that baseline. So when I refer to a diagnosis, I'm talking about the criteria listed in the DSM. The DSM is the book, the manual of all psychological disorders. And each one has a set of criteria that has to be met in order for the person to have that diagnosis. Sometimes someone can have a lot of symptoms of some disorder without meeting criteria for that disorder. So I'm going to talk about disorders and not meeting criteria, or disorders or not having a disorder in the next couple of slides, and just want you to know what I'm talking about. So psychotherapy can be helpful in this case, even if someone does not meet criteria for the diagnosis of generalized anxiety disorder. But in generalized anxiety disorder, short-term relief often results in more worrisome thoughts about what others might think of you or your behavior, or simply the stimulus that's causing the anxiety. So when we have generalized anxiety disorder, or even just that higher baseline level of anxiety, if it doesn't reach the level of generalized anxiety disorder, we use overcompensating behaviors to decrease anxiety in the short term. Usually this is by avoiding or escaping the anxiety-inducing stimulus, but these overcompensating behaviors actually maintain your overall anxiety. The behaviors maintain this intolerance of uncertainty. The overcompensating behaviors are reinforced by the short-term relief from the anxiety that's caused by the thoughts or the worry. And your intolerance of the the anxiety is the result of the inability to tolerate not knowing or the uncertainty. And avoiding it does not make that intolerance go away. It makes that thing that brought it up go away for a short time, but you're now in a cycle where this intolerance of uncertainty comes up again. You're going to respond the same way, and you're never learning to deal better with that to better deal with the intolerance of uncertainty. So you're caught in this cycle of ineffective anxiety management, resulting in more anxiety. You can learn more about anxiety and autism in the Johnson Center's webinar available on YouTube called Autism and Anxiety. Social anxiety and social challenges are also common issues for people with autism, and these can also be addressed in therapy. Social anxiety is the fear of interaction with other people that brings up feelings of being negatively judged, and it often leads to social avoidance. Even when someone does not meet criteria for social anxiety disorder, social challenges can be a source of distress, and psychotherapy can be helpful for that. Psychotherapy is a safe place where a person can process social experiences or get a new perspective on their challenges. They can learn social skills to take others' perspectives, or empathize, or follow social expectations. And they can practice relational skills in the therapeutic relationship with a supportive and secure and safe place and safe relationship. And all this while also gaining the skills to tolerate emotions and change any distorted beliefs that are keeping them in this cycle of feeling judged and then avoiding. I've talked about alexithymia a couple times already, but this term refers to the inability to recognize emotions in yourself or in others. This is common in people with autism. But just because someone doesn't recognize an emotion does not mean that they don't experience it. Someone with alexithymia can struggle to manage their responses to stress because they don't recognize feeling angry or feeling scared, but they're still acting on that feeling, or they don't recognize that feeling until it gets so intense that now they can't control it. It can also make forming connections with other people more difficult. If we can't connect with someone emotionally, we can't empathize with them or relate to their experience. And therapy can and should teach emotional literacy skills. Related to emotional literacy is emotion regulation, which is the ability to experience an emotion at a level that allows our most optimal functioning. Too much of an emotion or not enough of an emotion can both be problematic in most scenarios. Behaving inappropriately because we're caught up in emotions. Emotion regulation is a skill that's learned over time. We don't expect toddlers or little kids to have emotion regulation, but it's something that they learn as they get older. But this can be especially difficult for people with autism. Psychotherapy can provide the skills and strategies that are needed to experience emotions without them becoming overwhelming or without acting on impulse, without thinking. Emotion dysregulation, the inability to regulate emotions, may underlie conditions like anxiety and depression and even some challenging behaviors. A person is experiencing emotions at inappropriate intensities. Too much, too intense of an emotion, or not enough of an emotion. So, for example, if a person has no fear of running into the street, that's not enough of an emotion. That's just a example, but that's basically what I'm talking about when I say not enough of an emotion. Emotions are protective, and if we're not experiencing them at the level that protects us, then that's not adaptive. Mood disorders like depression and bipolar disorder can co-occur with autism. Some sources suggest that rates of depression in people with autism are even higher than in the general population, but these numbers are difficult to measure and they vary depending on the source where you're looking. Diagnosing mood disorders in people with autism can also be difficult because of the different ways in which people with autism sometimes express their emotions. Medication and therapy, or a combination of the two, have been shown to be effective in treating mood disorders with people with autism and people without autism. And as described previously, modification to traditional therapy can make therapy an effective option for people with autism who also suffer from mood disorders. Obsessive compulsive disorders are actually a whole class of disorders, and it includes impulse control disorders and trichotillomania. Trichotillomania is hair pulling. Other disorders like that involve obsessions and compulsions. Obsessions are thoughts and compulsions are behaviors. The rates of comorbidity between autism and obsessive compulsive disorders are high, meaning they often occur together. Now, similar to generalized anxiety disorder that I talked about earlier, obsessive compulsive disorder can become a cycle that reinforces itself, making it hard to stop. Obsessive thoughts lead to anxious feelings. Compulsive behaviors relieve the anxiety, but the obsessions are irrational and the compulsions don't truly fix whatever is the fear. that's in the obsession, so the obsessive thought comes back and the cycle repeats. Now, although autism can include symptoms like rigidity and rituals and compulsions, when these behaviors get to the point that they interfere with daily functioning, they can't be classified as separate disorders and treated as such. Obsessive compulsive and other related disorders are rooted in anxiety, and there are very effective cognitive behavioral strategies that can help. Trauma is described as an emotional wound or a shock that causes substantial, sometimes lasting damage to psychological development. Sometimes a series of small but adverse life events can have the same effect as a single big traumatic event. Most people think of trauma as severe child abuse or a horrific accident. And while those things can be traumatic, don't underestimate the trauma of, or the potential trauma of adverse social experiences or overwhelming sensory stimuli for a person with autism. That's not to say that any child who has experienced these things has trauma. Not everyone experiences the same way. I just urge you not to discount them as insignificant. Consider that they may be having some effect. Maybe not a traumatic effect, but they may have some effect. Okay, now I'm going to talk about a few things to think about if you're looking for a therapist for yourself or for a child with autism. The first thing is, what is it that you're looking for out of therapy? Are you looking for insight-oriented therapy, or are you looking for someone who can increase resources or coping skills for emotion tolerance? The approaches of some types of therapy are better at meeting different needs. Now, that's not to say that therapists who primarily practice one type of therapy can't help you when the purpose of therapy is something else. But it can be helpful, although not required, that you know going in what is the purpose of therapy, what you want to get out of it, so that you can ask questions about how they would work with you toward that goal. Experience with autism is also something to consider. Now, depending on where you're located and what's available to you, it may not be possible to find a therapist who has experience with autism, but it can be helpful to have someone who has knowledge of symptoms that are because of autism, but also knowledge of what's not because of autism. So if we can find a therapist who has knowledge of and experience with autism, that can be helpful in differentiating symptoms and getting a accurate diagnosis of what's autism and what's not. Now, this does not necessarily mean that that the therapist should have lots of experience in psychotherapy with people with autism. You're just looking for someone who truly knows and understands autism in their personal context or in some other career context, if possible. Certainly a therapist who has training or can do some research on people with autism or consult with someone who knows can be an effective therapist. It's not absolutely necessary that the person have experience with autism, but it can be helpful. For example, if a client brings up a topic or something they're afraid of repeatedly, a psychotherapist who's working with a neurotypical client might conclude that, well, they're anxious or anxiety present, and explore that topic pretty thoroughly. However, in someone with autism, that topic or that fear might be a perseveration, the unreasonable repetition of an action or speech about some topic. So unlike exploring this topic, as you would with a neurotypical person, engaging in a perseverative topic with someone with autism can, not always, but can make it worse. So instead, the therapist who is familiar with autism might recognize it as perseveration. He or she might include that there's stress or anxiety or some other need for coping that's there, and that is kind of behind that perseveration. But rather than exploring it, they might shift the focus to providing calming strategies and support in another way. Also consider developmental age rather than the chronological age of the client. So if you have an 18-year-old client, but developmentally they're closer to a second grader, the therapist needs to use the types of techniques and interventions that they would use when working with a second grader. So bringing in things like play and art and simpler language, but in a way that does not make the person feel like they're being treated as a child. So when choosing a therapist, consider the ages of the clients they see and whether or not that matches the developmental age of the client rather than the chronological age. And the last thing I want to talk about is confidentiality. Unless a caretaker is awarded guardianship, gosh, excuse me. Unless a caretaker is awarded guardianship, an individual becomes an adult at the age of 18, regardless of their developmental age. Confidentiality is the protection that's awarded to the relationship between a therapist and an adult client that prevents the therapist from disclosing any information shared with anyone else, except under very specific circumstances. This might be something to think about and talk about with potential therapists about how they would handle clients with developmental delays, but who are over 18 and without guardianship in place, because challenges can arise. A parent or caregiver or other person might need to be present to help with communication between the therapist and the client. If I worked with someone once whose his mom had guardianship, but she had to be present during our sessions because some of the language that the client used was not clear to me what he was talking about. So he would talk about going to the beach, but what he really meant was going to a swimming pool. And there was no, I couldn't know that if his mom wasn't there to sort of translate for us. So just, examples like that, it might be necessary to have a parent or caretaker or someone else in the room to help to communicate information. Also, sometimes information might need to be shared with the financially responsible party if that person is not the client. And even if the therapist has a client sign a release that allows the sharing of this information, how does the therapist know that the client is able to give consent? So it can be a good idea to talk to the therapist before starting therapy with him or her to go over some of these details like this and just know what to expect regarding confidentiality in these kind of different situations. Okay. So it looks like I have just a few minutes for some questions. If you give me 1 minute to pull them up. Okay. Someone asks, in your experience, can someone on the autism spectrum be a counselor? And yes, absolutely, they can. For someone to become a counselor, some of the the most important skills that you might have would be things like empathy and perspective taking and that training and whatever is your theoretical orientation for counseling. I'm so sorry, I'm losing my voice. And while some of those things can be challenging for someone with autism, there are also things that people with autism can learn. So if someone has autism, but their passion is in mental health and they want to be a counselor, they absolutely can do that if they, as long as they recognize that there might be some things that are more difficult for them and learn those things, or if needed, if they haven't, if perspective taking or empathy are difficult for them, maybe they get their own therapy to work on increasing those things. In your opinion, is it necessary to give medication to someone with autism? I am not, medication is not my expertise. I always refer to a psychiatrist when considering medication. So I'm not able to answer that question. There are things that can be treated with therapy and don't necessarily need medication. And in that case, I'll work with the client and see what they prefer. Maybe we give it a 3 or 6 month trial period with just therapy before I refer them to a psychiatrist. But it is not my expertise to say whether or not they should have medication. And is it more important to have someone who with experience with autism or who is well-trained in cognitive behavioral therapy with some experience with autism? So that really depends on what is your goal for therapy. If your goal for therapy is something that CBT can address, CBT, someone with training in CBT is probably going to be more important than the experience with autism. No, as long as that person knows that some modifications might be necessary in treating someone with autism, some of those modifications that we talked about. And for you as a client or a parent of the potential client for that therapist, it might be a good idea to bring some of that with you to say, this is how she learns well. This might help to keep her on task, and give the therapist those tools that they can use to do that. If you're not looking for, or if it's not something that you're going to definitely use cognitive behavioral therapy for, then finding someone with autism experience might be more important. However, I do want to emphasize that I know that someone with autism experience is not available to everyone or everywhere, and that should not stop you from looking into therapy. It's absolutely possible for a therapist without a lot of experience with autism to still be an effective therapist for a person with autism. So don't use that as a reason not to look for it or to look into the possibility of doing therapy. it can still be very effective for some, if you find the right therapist for your child or for you. Okay. If you would like a certificate of attendance, look for a follow-up email that'll be coming in the next 24 hours. This will have a link to a short quiz that once you complete, it will allow you to download a certificate. The recording of this webinar will be available on YouTube very shortly. We do not provide the slides as handouts, but the webinar will be available. A recording of this will be available on YouTube. To receive updates on the webinar schedule, follow us on Facebook or Twitter. And for more information about the Johnson Center's services, contact us by email or phone. And thank you so much for your time and attention. I really appreciate everyone being here today.